Thanks to early diagnosis and new treatments, more men are surviving prostate cancer than ever before. Prostate cancer is one of the most common forms of cancer among American men. It's estimated that this year, over 200,000 new cases of prostate cancer will result in over 40,000 deaths. As Dr. Case-Ketting of St. Jude Medical Center in Fullerton explains, some of these deaths could have been avoided with early diagnosis and treatment.
Well, prostate cancer is a cancer or malignancy of the prostate gland, which is a gland unique to men. One of the new buzzwords or phrases in radiation therapy of prostate cancer is IMRT, or intensity modulated radiation therapy. I think the best way to explain it is sort of a CAT scan in reverse. We're putting dose densities where we want them by using thousands of tiny little X-ray beams and turning them on and off, and essentially modifying their intensity to put the dose where we want it, in this case on the prostate and not on the sensitive structures around it. Back when we started out treating prostate cancer, we pretty much kind of looked at the outside of the body, maybe had an X-ray and aimed a beam at it, typically from 2 or 4 different directions. Because we were very uncertain about that, not being able to actually see the prostate but only the surrounding bones, we made big fields, and they treated a lot of the surrounding structures. Now with CAT scans and three-dimensional volumetric imaging technologies, we are able to see the prostate, and we need to make our fields much tighter to conform to the shape of the gland. Well, one of the critical issues with treating prostate cancer is that it's sitting right in front of the rectum and the bladder. Both are quite sensitive to radiation therapy. And by daily targeting it, we can keep the beam away from those structures and spare a lot of the toxicity that we used to see. Many people forget that with all this fancy stuff we're able to do with radiation therapy, making really tight dose distributions, if we don't target the right area, then it's all lost. And with such tight distributions, we can miss the right area if we're not pointing at the right spot. And I think the real sleeper issue in prostate radiation is, where is the prostate when you treat it every day? Because it definitely moves around. And one of the things that we've used to address this is an ultrasound targeting mechanism or technology called BAT. And basically what it does is we do an ultrasound of the prostate every day through the bladder. We see where it is, and we target where it is that day. Doesn't matter where your bones are, where your skin is. It matters where the prostate is in relation to where we're shooting. We need to shoot directly at the prostate. And now we can see it on a day-to-day basis and shoot it. With these advances in technology, we've been able to make a tighter beam distribution, place it every day on the prostate. That gives us the ability to safely increase the dose, and that has clearly resulted in increased cure rates in prostate cancer over the last 10 years. Well, one of the mistakes that I think we make in our modern age is that we think technology is the solution for every problem. Technology only helps us, but if you misapply it, if you have somebody that doesn't know how to use it or doesn't care about the patients, it's not going to help you at all. And one of the things I think we have at St. Jude that I'm proud of in our department is a very good staff, seasoned, mature people who are committed to the goals and who clearly care about their patients.